Savina Singh, the Director of Intellectual Property and Commercialization at UKZN Incubate, which is the innovation office at the University of KwaZulu-Natal. We have a focus on technology transfer, consultancy, as well as student entrepreneurship. At Incubate, we try to ensure that our efforts are directed towards addressing significant challenges, which invariably has relevance locally as well as internationally. We work hand in hand with our researchers, industry partners, as well as our funders to translate this research into solutions which can benefit society, the economy, as well as the environment.
Our team at the Catalysis and Peptide Research Unit has developed a series of novel metallo-beta-lactamase inhibitors using synthetic organic chemistry. Existing antibiotics have lost their potency due to infections caused by resistant bacteria. So antibiotic resistance globally now is referred to as the silent pandemic because it claims the lives of more than 700,000 people annually. So our lab has developed novel metallo-beta-lactamase inhibitors that's able to restore the activity of existing antibiotics in the presence of this resistant bacteria. And this is important because currently there is no clinically available metallo-beta-lactamase inhibitor on the pharmaceutical market. Our hope is that we could partner with a pharmaceutical company and take these compounds to commercialization and hopefully reach a patient so that it can help save lives and essentially treat antibiotic resistance.
So the technology that I developed is for autopsies. We manually transcribe all the information from our autopsies into paper reports. These paper reports are then used for court purposes. But we extract information for things like resource purposes as well as for statistics. So originally it was my own personal research for a project because I just found when I was doing my master's, it was very hard to get information to do my research. So I had to go into like a big facility with lots of files and go through manually. So I thought maybe it'd be easier if we could create something that would store all this information. So the technology was created to improve our manual recording system because we now have the technology to have electronic record systems. The application is you enter it straight after your autopsy, you enter all the relevant information. It then instantly reports, gives you a report on the app, and from there you can instantly create statistics. So related to age, gender, race, as well as cause of death, and as well related to what happened, so the history. So the doctor, once they perform the autopsy, they immediately enter the information, and that information is automatically sent through to the cloud and sent through to create the statistics. So if somebody at the end of the week may even comes and asks, has been a large increase, have you noted a lot of people maybe dying from COVID, because that's also one of the things that we looked at. So if you're seeing a large increase, it can automatically be sort of flagged. So this can be like an early warning, and so that's how it will impact socially as well as the government. So I created this application. First, it started off as my pet project because I wanted to use it in my mortuary for research purposes and my students. But ultimately, I saw like a bigger goal. I mean, it could be used in other mortuaries. We could have actually provincial statistics. We could also have national statistics.
A group of researchers at the University of KwaZulu-Natal have developed a thin film organic semiconducting material that has fascinating electronic properties. the material can change from a N-type carrier to a P-type carrier merely by changing the composition of the two components of the material. This induces remarkable electronic properties that make it useful as a saturable absorber in a medical laser, as a communication device, in cell phones, as a transistor, and also as a radio frequency transmitter.
The aim of this project is to actually replace the currently commonly used material, which we all know is silicon, which has got good efficiency. However, it has got its own challenges. It's got rigidity as an issue, it's not flexible, it's not biodegradable, and it's not cheap. So our project looks at an alternative, a more sustainable approach. And in this case, we're looking at this material that is flexible, it's biodegradable, it's easily available from the biomass that we have, which we are rich in. So far, we've been able to actually achieve good efficiency, and it shows quite promising in terms of solar panel properties. We should pay attention to this project because it's an exciting project. The material shows good flexibility, one. It shows good properties. It is flexible, renewable, it's cheap and sustainable relative to the common known silicon. Hence, it has got good feasibility.
Our contribution will be vital to South Africa since it will not only help in resolving energy issues, however, it will also open doors to create greener products. In addition, it will also assist in job creation and also increase the manufacturing capability of this country. This work addresses United Nations Sustainable Development Goal number 7, which advocates for clean, affordable, modern energy for all.
So if I take you back to my beginning when I started studying, it was not uncommon for us to be told we can't really do much to accelerate wound healing. But what has been interesting is that technology changes, medicine brings in more science, and certainly through a process of observation that doctors have in treating patients, what became very apparent to me that there are ways and means of improving wounds per se. So having observed how tissue expansion worked really as part of my early portion of the training, and when I became a consultant, it gave me an idea to see how is it that we can still expand tissue, expand skin, but use something without operating, use it on the external surface. And that's where the idea of use of tape, which is simply a simple tape used for wound dressings, holding dressings onto skin. We use that to apply a mechanical force to stretch skin. What has been happening in terms of wound healing, other than the chemical side, other than the hormonal side, but the thinking that using a mechanical force can change the way wounds heal. And one of the first kind of mechanically orientated devices that came out, we referred to as vacuum assisted closure. Now, just to give an idea what that really is. So a wound is dressed, a vacuum or negative pressure is subjected to it in an occlusive environment. But by putting the negative pressure onto the wound, a lot of different things were happening, right? And through the mechanical force that was generated by the negative pressure, healing was improving, wounds were closing, and this was happening not only because we were able to increase the way the blood supply to the wound changes, but even cells behaved and tissue behaved differently. The technology that we came up with is we were just using a tape and we were strapping that across wounds, and we were using a very manual technique, use of hands, a paper tape, a scissors, and what have you. So it came a time where we needed to make the process less cumbersome. So a device was created over a period of about 4 to 5 years where we were able to deliver the tape, apply the tape, and use the tape to migrate tissue and apply that force so we accelerate and improve wound healing. The device that we've invented, essentially the name we've called it is tape-assisted closure. Now what that tape-assisted closure means to us is that we're using a tape to apply to a wound and skin around it, applying the mechanical force because we're migrating tissues under the tape, and that tape then holds the wound closed for us. And by holding it in that position, the tissues actually feel a traction force, they will feel some form of compression, and this is the mechanical force that then acts on the biology of the cells in the wound and the tissue around it. And as it activates the biology, we anticipate that it will help in assisting accelerating wound healing, and certainly for the problematic wounds where wounds are not healing the traditional classical way, we expect to have fairly good breakthrough in terms of dealing with those kind of patients who are sitting with difficult wounds, and we hope to make a change in their lives with the use of this device. I think from a cost point of view, I have no doubt in my mind that this is going to be cost effective and certainly effective in terms of its surgical goals that we've always, more often than not, reach with the use of the device.
We featured a few technologies in our portfolio which we've advanced significantly through research and development and which are ripe for commercialization. Our technologies are strongly aligned with the United Nations Sustainable Development Goals, and we're intentional about this because we try to make a contribution towards sustainable socio-economic developments. We're open for partnerships and collaborations, so please do contact us.